Millions of Americans suffer from Alzheimer's disease, and almost 11 million Americans provide unpaid care for a loved one with Alzheimer's. Bob DeMarco is one of those Americans. Bob left Wall Street to care for his ailing mother and then founded the nation's largest Alzheimer's disease caregiver blog. Today we're fortunate to be joined by Bob, who's going to share his inspiring journey and his tips that have helped him cope as a son and caregiver. Joining us today also is nationally renowned Alzheimer's expert and neurologist, Dr. Mark Brody, who is going to discuss with us symptoms of Alzheimer's, what you should do if you expect your loved one has the disease, and management and treatment options. Welcome, Bob and Dr. Brody.
Morning.
Good morning.
So, Bob, what are some tips that you can give to folks who may have a parent who is suffering from Alzheimer's disease?
I have an article up this morning on the front page of my blog at the Alzheimer's Reading Room where I list 6 caregiver tips. The first one happens to be about treatment, and in the case of my mother, she's on the combination treatment of Namenda and Aricept. That has worked really well for us, and I have a scientific article underneath that. My basic core for tips are you need to continue to live your life the way you always have. So in the case of my mother, we go to the gym and exercise. We go out to restaurants and mingle with other people. I try to get my mother to socialize, even talk on the telephone as much as possible. And it's important to get Alzheimer's patients out into bright light. It seems to improve their mood. So my tips really are based around the idea of the Alzheimer's patient has to have a life, and together the Alzheimer's caregiver and patient should live their life the way they always have.
You know, Bob, it must have been just terrible to have gotten that news once it was discovered that your mom had Alzheimer's. How did your family cope once you actually discovered what the diagnosis was?
It is gut-wrenching, and it's certainly scary, and you go through all the stages of grief and everything else when the diagnosis comes in. In the case of my family, we all dealt with it differently. I moved to Delray Beach, Florida to take care of my mother, so I was on the ground and sitting in the front row. My brother and sister live up in the Philadelphia, New York area. So everybody copes a little differently. Certainly when you're what I call the one person who's going to take care of the person with Alzheimer's, you have a very tough task, and your emotions go up and down like a roller coaster. You have to learn to understand Alzheimer's disease, what the difference is between Alzheimer's and dementia. You have to learn a whole new skill set on how to communicate effectively with someone from Alzheimer's. And you have to learn that if they are mean-spirited, which is often the case, and they say something mean or nasty to you, that's not them. That's a product of the Alzheimer's disease. And you have to learn how to separate the two.
That's right. Now, Dr. Brody, what are some of the symptoms of Alzheimer's?
Well, some of the most common symptoms are trouble with short-term memory, and that may present when family members say, well, you know, I talked to Mom, we just talked about this on the phone the other day, and she's asking me the same questions again, or she's telling me the same stories. She's having family members having trouble finding their words. They're having trouble doing all the things they used to do easily. Balance their checkbook, pay bills. They're misplacing things. These are some of the warning signs, and as in Bob's mother's case, a change in behavior and personality. And those are red flags that it's time for the family to help this person get to a medical person, somebody hopefully whose expertise is in memory disorders, to try to get to the bottom of this and try to get on some treatment.
Are there medications that are available to treat this?
There are 4 medications that are FDA approved, and in Bob's mom's case, on Aricept and Namenda, which seem to be a good combination for his mom and seem to help with her behaviors quite a bit. These are symptomatic treatments, so it doesn't really change what's going on in the brain or stop the disease from progressing, but it can help a lot with symptoms and help caregivers cope at home.
Where can people go if they really think their parent or loved one might have Alzheimer's? Are there some resources available that they can reach out to?
The Alzheimer's Association in all the local areas will have recommendations as to where people can go. There are actually certified memory centers and people doing clinical research and making an accurate diagnosis and trying to help people get exposure to new drugs that we're looking at that potentially could be breakthrough drugs. And that's primarily what I do. And for a little bit of education, you could go to my website, brainmattersresearch.com, where we explain things in detail about the diagnosis, current treatment, and what state-of-the-art therapies and investigations that are going on right now.
Bob, thank you so much for sharing your story today. Dr. Brody, thank you both so much for being with us. We really appreciate getting this very valuable information.
Thank you. It was great talking to you today.
Thanks.